Good morning everyone, and thank you for the presentation. Today I'm going to present the fish tank simulator, a training tool to learn how to perform the endoscopic treatment of pediatric vesicoureteral reflux. This consists in injection of dextronomer hyaluronic acid in the submucosal area of the ureteral ostium. I have nothing to disclose. The study we conducted aimed to evaluate the phase and content validities of a novel 3D printed model as training tool for endoscopic injection of bulking agent. As you can see in the video, the first thing you can do is to enter into the blood with a cystoscope. Then you eliminate the air from the needle, and you can visualize the ureter and choose the one you want to treat. You visualize the ostium of the ureter, where there are 2 marks for the injection. You can inject 2 times for a ureter model. Then you can turn around the ureter and you can inject another 2 times. So there are 4 injections for ureter model. As you can see, the needle is entering, and then you can inject 1 cc of bulking agent and create the mound. In this study, we combined part 1 and part 2 for a total of 72 participants. They answered a post-hoc questionnaire after completing the training session with the 3D printed fish tank simulation model. The questionnaire is based on a 7-question, 5 points Likert scale to assess phase and content validity. Regarding the training status, 31% of participants were fellow or specialists, and 69% were surgeons in training. Their level of confidence in endoscopic injection procedure was defined as novice if they performed less than 10 procedures per year, and they were 71%, intermediate if they performed 10 to 20 procedures per year, and they were 14%, and expert if they performed more than 20 procedures per year, and they were 15%. Results show that regarding both phase validity and content validity assessments, no statistically significant differences were found between scores given by novice versus intermediate expert groups. Similarly, no statistically significant differences emerged between scores given by participant versus faculty group assessing the content validity of the simulator. The simulator was considered a good teaching tool for beginners by 87% and for pediatric surgeon by 69%. So overall, both of the groups found the tool useful and effective. We assessed also timing improvement in the injection of the bulking agent to demonstrate the short learning curve of this tool. Indeed, all attendees showed a significant reduction in median injection time and a significant improvement in mound quality scores. However, some features may be improved, such as water management. Indeed, it's necessary to provide a dry lab with waterproof sheeting to protect the furniture, towels for water absorption, and a small cap to remove excess water from the tank. It could be useful also to introduce different configuration of ureteral hiatus, to add the element of other distension, and to improve the quality of the biomaterial. Of course, also to create a male anatomy model could be useful too. In conclusion, the 3D printed simulation model is high fidelity, accessible, and cost-effective simulator that improves technical skills for endoscopic wound injection. Its realism, ease of use, and objective performance metrics supports its inclusion in structured training curricula. Thank you for your attention.
Any comment, any questions? Only one, yes.
I have one question, Jonathan Redon, Street Hospital, London. You had all the possibilities also to test for construct validity, basically comparing novices and more experienced surgeons to really also validate for construct validity. Did you do that? And furthermore, we know of other studies that you also should test for concurrent validity. Did you also compare it to other models, give them the possibility to compare it, because we know that participants wrongly give higher scores if they don't compare it to other models.
Yes, I think it would be useful to implement also scoring between novel and experts also in training and in other model training.
Thank you.
Thank you. That's fine. Thank you. We move to the next.